Good evening, everyone. My name is Dr. Pradeep Shenoy. I work as a consultant nephrologist and assistant professor in the Department of Nephrology at Mangalore, Karnataka, India. Today, I'll be discussing about the various forms of chronic kidney disease and what are the common physical symptoms or signs the patient will present in a patient who has a kidney disease, and how we can best manage common symptoms of kidney disease. Okay, so let us first begin with understanding what does kidney functions are. Okay, so kidney is one of the vital organs in the body. It is a bean-shaped organ which is present in the abdomen. Okay, and right on either side of the vertebral column. It's about 9 centimeter to 4 centimeter in size, and it carries important functions. The functioning unit of the kidney are called as nephrons, and these perform various functions. Most important kidney function is to filter the blood. We know whatever food we consume, it's going to get metabolized and is going to release water, energy, and some toxic metabolite. And these toxic metabolite or end product should be excreted from the blood. And the main function, main organ which performs this function is the kidney. Okay, we call it as a glomerular filtration. Now, in addition to keeping the blood safe or removing the toxins from the blood, kidney also performs various other functions, including maintaining blood pressure. Okay, you might have heard a lot of patients who have issue with high blood pressure or low blood pressure. So most of them are related to one or the other issue in the kidneys. Apart from maintaining blood pressure, it's also important to maintain the salt in the blood. So any kidney disease can cause either increase or decrease in the salt level in the blood. Apart from these, the kidney is also important for maintaining the hemoglobin level of the body by producing a hormone called as erythropoietin. Now, erythropoietin is an hormone which is produced by the kidney. Whenever there is decrease in the hemoglobin, in a medical terms, we call it as anemia. Apart from the erythropoietin hormone, kidney is also important for production of sunshine vitamin. You might have heard that we call vitamin D. It's also called sunshine vitamin. Is produced from the skin on direct exposure to the sunlight. However, the further activation of this vitamin takes place in the kidney. Therefore, any abnormality in the kidney can lead to vitamin D deficiency. And we already know that vitamin D is very important for the health of the bones. So if vitamin D is deficient, then we may be having bone problems as well. Okay, as you can see from the short list of functions, the kidney performs a lot of functions, including filtration of the blood, purification of the blood. Apart from that, it's also important for production of hormones and maintaining the acid-base status of the body. Now, let us talk about few important kidney disease. Okay, there are various forms of kidney disease. The one which I'm going to discuss today is called as chronic kidney disease. In layman term, we call it long-term kidney failure. We also label them as permanent kidney failure. Now, what happens in chronic kidney disease or permanent kidney failure is that there's a progressive deterioration in kidney function over a period of months to years. The minimum time duration is about 3 months. So in a period of 3 months, the kidney loses its capacity to work. Mostly, it involves the filtration of the blood. So because of this progressive decline in kidney function, the patient may progress from the mild kidney problem to what's called as end-stage kidney disease. Okay. Now, one of the marker of kidney function is known as GFR, which stands for glomerular filtration rate. And this is calculated by either directly in the laboratory or by indirectly using a blood test, which is known as serum creatinine. So based on the serum creatinine, we can calculate the GFR, which is called as the estimated GFR or eGFR. Now, based on the eGFR level, we can classify chronic kidney disease into 5 categories. The first one is called as chronic kidney disease stage 1, where the patient has near normal kidney function. The GFR is more than 90 ml per minute per meter square. So normal GFR is about 120 to 125. So stage 1 CKD, still the patient has a good kidney function, but patient may have mild abnormality like proteins in the urine, or ultrasound or scan of the abdomen may show some changes, structural changes in the kidney. Coming to the stage 2 CKD or chronic kidney disease, here the GFR varies from 60 to 90. In stage 3 chronic kidney disease, the GFR will be between 30 to 60. Similarly, in stage 4 chronic kidney disease, the GFR will vary from 15 to 30, and stage 5 CKD, the GFR will be usually less than 50. Now, stage 5 CKD is also known as end-stage renal disease. This is because at this stage, the patient may require some form of renal replacement therapy, either in the form of dialysis or kidney transplantation. Now, these are the various stages of the chronic kidney disease. Now, let us understand what are the symptoms of chronic kidney disease. Okay, so we know there are the risk factors for the kidney disease are long-standing diabetes, long-standing hypertension, some genetic kidney diseases, intake of analgesic drugs, or intake of certain alternative medication. So whenever the patient has these risk factors, it is worthwhile that we check their kidney function at a periodic interval. However, we know that most of the patients with chronic kidney disease are asymptomatic. They may not present with any symptoms. And whenever the symptoms are present in a particular patient with a chronic kidney disease, most of the time, they are usually in the advanced stages of kidney damage. Okay, so it's better that you don't wait for the symptom to begin with. You always test at a periodic interval, especially those individuals who have high risk of chronic kidney disease, such as those individuals with diabetes or hypertension. Now, what could be the symptom of chronic kidney disease? The symptoms of chronic kidney disease could include, one is the swelling of the legs, or we call it as pedal edema. The second is the patient can have changes in the urine. Urine can become darker, urine can become red, or there could be frothiness in the urine. The amount of urine which is passed in a day could be less or could be more. Apart from this, the patient can have some decreased appetite. They can have some vomiting, some abdominal pain. They can also have fatigue. They can have some shortness of breath on exertion. They can also have some itching all over the body, or they may be a bit drowsy, or they can throw a fit. So these are some of the common symptoms of the chronic kidney disease. Okay. Now let us understand among these symptoms, the commonest what generally we see in practice is the swelling of the legs or pedal edema. Now remember that swelling of the legs or pedal edema could be a cause or could be the presentation of multiple diseases. These diseases include chronic kidney disease. It could be because of the heart failure. It could be also because of chronic liver disease. It could also be because of some malnutrition. So although pedal edema does not limit itself to as a etiology, as a presentation of chronic kidney disease, pedal edema should be considered, and such patients should be evaluated further for any kidney disease. Now, why do we get swelling of the legs or pedal edema in a patient with chronic kidney disease? There are two important reasons. First, we know that the kidney, because they have an segment or a functioning unit known as nephrons. And in the nephron, the basic function of the nephron is to filter the blood, which is called glomerular filtration. Now, normally, whatever proteins are there in the blood do not come in the urine, because we know proteins are very important for our body. Proteins are very important for the building up of the cells and different organs. So normally, we do not lose any proteins in the urine. However, in conditions which cause chronic kidney disease, there is damage to these filters, which are called as glomerulus. So whenever these filters are damaged, it results in loss of protein from the blood into the urine. So now you are getting the proteins in the urine, which should have stayed in the blood. Now, the moment you start losing proteins, what happens is the protein level in the blood will decrease. We call this condition as hypoalbuminemia, or reduced level of albumin, which is one of the most important proteins in the body. Now, when you start losing proteins in the urine, and which results in low albumin in the blood, what will happen is it will cause accumulation of the fluid in the tissues. So accumulation of the fluid in the tissue is known as edema. So this edema usually starts in the legs. This is because most of the time we spend our day standing. So because of the effect of the gravity, we find that this swelling or the edema usually localized to the legs. Now, another cause of the edema, which is proposed in chronic kidney disease, is because of the retention of the water and the salt. Now, we have already described the function of the kidney, and one of the function which I mentioned was to filter the salt and the water. Now, as you can understand that as the kidney function declines or decreases, we see that the salt and water excretion rate decreases. That means the salt and water are going to get accumulated within the body. And whenever the salts and water get accumulated in the body, there'll be excessive fluid which can leak into the tissues, causing edema. Okay, so this is the second reason why we get swelling of the legs in a patient who has got chronic kidney disease. So because of these two mechanisms, we see edema in patients with chronic kidney disease. Now, the edema is not only localized to the legs. In case of children, we can also see swelling around the eyeballs. We can also see the swelling around in the face. We call periorbital edema, or called facial puffiness. Okay, so in pediatric or in children, we might get the swelling of the face in addition to the swelling of the legs. Now, how we can treat this swelling, or how we can treat the pedal edema? So there are various treatment options for treatment of chronic kidney disease, where we treat symptoms of pedal edema. Now, one of the foremost treatment what we have is by using what's called as fluid restriction. Now, we know that the kidneys are important for regulation of water and salt. Now, if you're going to drink too much of water, it is going to get accumulated because the patient may be having reduced kidney function. So more water the person drinks, more is the swelling of the legs. In other words, fluid restriction, or restricting the amount of fluid which is consumed in a day, is a first intervention or first recommendation generally given to a patient who has pedal edema. So just restricting the fluid may not be good enough. We need to restrict the salt as well. This is for the simple reason that if you're going to consume too much of salt, what happens is you will feel thirsty and you will be compelled to drink water. So this decrease in the salt in the diet, and decreasing the fluid intake in a 24 hours would be the first step in managing patients with pedal edema. The second step, what we have, is called as the use of drugs. Now, among the drugs which are used for pedal edema, the most prominent group of drugs are called as diuretics. It just simply means that these are the drugs which are going to increase urine formation in the kidney. That's why it's called diuresis. Now, how do these drugs act? So these drugs, once we consume, it is going to enter into the blood. From the blood, it is going to get filtered into the kidney. In the kidney, it is going to block the absorption of salt and water. Okay, it's as simple as that. It's going to decrease or inhibit the absorption of salt and water. So when you lose salt in the urine, it's going to draw a lot of water along with that, and your urine volume will increase. Okay, so whenever you take diuretics, your urinary volume will automatically increase. Now we have various group of diuretics which are being used for treatment of chronic kidney disease. Okay, so these drugs act at multiple levels in a nephron. So one of the powerful group of drugs which you use are called as loop diuretics. Among them, we have drug called furosemide and torsemide. So these are one of the commonly used diuretics in chronic kidney disease. Now, these classes are distinguished because they can be used even in stage 5 CKD. So stage 5 CKD are group of individuals who have very low GFR or a low kidney function. So despite having a low kidney function, these group of diuretic, which are called loop diuretics, are able to function by inhibiting the salt and water reabsorption. Now, using a diuretic, a patient should be counseled that patient may have increased urinary volume. They might have to restrict their water intake despite having excessive volume, thereby which will promote the loss of water and reduction in the weight. They should also be counseled for decreasing the salt intake during the consumption of diuretic, and diuretic dose should be preferably taken in the morning or afternoon or in the evening, not to be taken at night because it may cause increased urinary volume, thereby disturbing patient's sleep. You should also be careful when using diuretic that your salt and water level might go down faster. So you should be monitoring certain blood tests like sodium and potassium during the therapy with diuretics at appropriate intervals. Apart from these treatment for the pedal edema, we also use edema which is compressing and the patient has difficulty in walking because of increase in the body weight. So if the patient has a progressive CKD or end-stage kidney disease, we find about 8 or 10 kilos of fluid in either of the leg, thereby making the patient difficult to walk, especially walking upstairs. So such individual can protect their leg as well as decrease the impact of edema by using certain stockings. We also have other options like what's called positioning a limb. So you can place the leg in a particular position most of the day so that you can keep that at a slightly higher place, or because it will promote the gravitational decrease in edema. So we generally ask the patient to use 2 or 3 pillows and keep the feet over the pillow so that the edema can subside. Also, whenever the patient sits, we can also try to keep the leg at a higher place so that the swelling can decrease on its own. So these are the few important steps how we can tackle swelling of the legs. Now, we also have other symptoms. As we mentioned, we have loss of appetite, we have loss of weight, and we also have the nausea and vomiting. So these are few of the important symptoms. So if you have any of these symptoms, you need to get your blood tested, and you need to check your kidney function, especially if you are having high blood pressure or you are having uncontrolled diabetes. Yes. So with that, I'd like to conclude a brief talk on chronic kidney disease and the importance of diuretics in patient with chronic kidney disease.